Hello, everyone. This is Howard from ICN, and I'm delighted to be supporting this Nursing Now lobbying toolkit. And I particularly wanted to give you some thoughts in terms of the allies, partners, stakeholders that you might want to think about working with as you're trying to influence decision makers to make investment in nursing. Those decision makers often have their own questions. Clearly, they'll want to be assured that what's being proposed really works. They'll have questions about what the costs will be. But they might also think to themselves, who supports this? Or are there any people who are opponents who may object? So when you're putting your plan together, think about within the nursing profession, is this something that student nurses and nurses who are further on in their career would support and would get behind? But it's not just within nursing. What about in the health workforce team? Who would physiotherapists, pharmacists, doctors, support workers, ancillary staff, would they get the logic of what you're trying to achieve and support it? And not just within your workplace. If you're in a hospital, for example, what might be the impact for people in care homes, those who work within public health or within social care? And broader again, what about within the communities that you live and work? Are there implications here for people who are involved in housing, for employers, people who offer employment? What about for the climate, for trying to create a healthier environment for us all? And what runs as a thread through all of those groups are the people who we're serving, patients, service users, or our public population more generally. Talk to them, understand their needs, explain your ideas, and try and see if they will work with you and support you. And a group that is critical not to forget is your National Nursing Association. Nursing associations are filled with people who will have gone through the sort of experience you are, who've been advocating and lobbying. They have experience from that they can help you with. They're groups that are focused exclusively on supporting and advancing nurses and nursing. They don't have another objective or agenda. That is their core purpose. They'll have access to wider expertise, communications, research, legal, for example. And associations have really significant networks and contacts, politicians and policymakers in all parts of their health system. So make sure that you connect with your National Nursing Association. You know, one of the biggest weaknesses we have when making a case for change and lobbying is if those we're trying to change their minds turn around and say, but you don't even agree amongst yourself. I hear some nurses say one thing and other nurses say another. So get out there, talk to people, build relationships, share, collaborate, and know what you're doing is critically important, not just for nurses and nursing, but for the improvement of the health of people everywhere.